Okay, great. So let's
Can you
get
hear
right
me
into
okay?
it. And glad to see your offices are open again. And where are you?
Yeah.
In Waynescott City
Yes.
right now?
Well, I'm actually, my office in Waynescott is 386 Montauk Highway, right on Highway 27. We're open. I'm very busy this summer, and we're also in the city working in my office, which is on 15th Street and 5th Avenue.
That's great. And that's good news, right? That you can be open now and receive patients in the office.
Yeah. Yes,
So
yes,
let's,
it's great. We reopened on May 18th. We had been closed for 2 months due to the pandemic, but we're really glad to be back. A lot of people were in need of all types of skincare, from skin cancer treatments to examinations and more. So
a little bit about Dr. Brown. He is a father of 3. He teaches in residence at NYU dermatology. He is the past president of the New York Dermatological Society, and his expertise is in skin cancer. So I wanted to talk about something that's kind of on a lot of people's minds about their skin, this thing called maskne.
sure.
People are breaking out due to wearing the masks, and it's giving them allergic reactions. And why is this happening, and what can be done about it?
So, yeah, the term has now been called maskne, but essentially what it is, it's a type of acne that's known as acne mechanica. We would often see it in athletes, for example, football players who would get their helmets rubbing against their foreheads, or other types of sports where there is friction. And essentially, there are 2 types of rashes we're seeing from the wearing of the masks excessively. One is directly related to acne, and where the rubbing and friction causes an excess amount of oil that then builds up and can cause pimpling and irritation at the site of where the mask touches. It can also be spread out onto other parts of the face if you have an underlying history of rosacea or acne. Some people are also seeing what we call irritant dermatitis or contact dermatitis, where they're actually just the friction itself is causing an irritation, or some people have an allergy to some of the components that can be in a mask, whether it's a elastic or rubber product. So it really depends on the type of mask you're wearing. If you're wearing a surgical or N95 or KN95 where there's a tight fit around the face, some people are just getting a very bad irritation right there. Other people who are wearing cloth masks, either from not washing them frequently enough and getting the oils out, or just from the heat and the sweat, are building up an acne around the mouth and on the cheeks. Go ahead. Sorry.
So what is it that you recommend that one do for that maskne?
So a few of the most important things are, A, pick the type of mask you want to use. If you're going to use a cloth mask, try to make it 100% cotton so it breathes. Be sure to wash it with some frequency so it doesn't build up with too much grime, dirt, and oil. As far as caring for your skin, interestingly, less is more. You really want to just keep it simple. You want to wash your face with a gentle cleanser. For example, I have something like this, like Cetaphil cleanser is very gentle, or Aveeno makes a very nice gentle cleanser. And you want to wash your face in the morning and before you put your mask on. And before putting the mask on, you want to hydrate and put a little barrier cream on your face. Something that contains a ceramide or dimethicone or hyaluronic acid are all good moisturizers and barriers for the skin to help prevent that friction and irritation. After taking the mask off, I'm sorry?
Acid prevent the friction.
Can you repeat that? I'm sorry?
Why would an acid like hyaluronic acid prevent that moisturizing
Hyaluronic
friction?
acid is one of the structural proteins of the skin. It actually helps bring hydration into the skin. But so it's not going to be acidic for it. It's just more some of the moisturizers that contain that help replenish some of the barrier and hydration to the skin. One other thing that I like a lot are these little cleansers. They make different companies make them, but Cetaphil makes one, which is this one. It's a very gentle hydrating cloth, and you can keep these in your pocket. If you start to feel the oil and the kind of oils build up and the grime build up during that hot day, you can wipe your face down to kind of get some of that off during the day. But after you take the mask off, it's very important, again, to use a very gentle, fragrance-free cleanser. and then to replenish the hydration with some moisturizer at night before you're going to sleep. One thing you want to avoid when I said less is more is putting on excessive makeup. That could irritate and make things worse, so less makeup is better if possible. If you do use a retin-A or retinoid type of medicine for acne or for anti-aging, etc., I would avoid using those excessively because some people are getting a lot of irritation just from the friction and the rubbing, and anything that is a retinoid or retinol can irritate that a little bit as well.
So let's talk about hydration a bit because, I want to know what the big myth is about it. You can't drink water directly into your skin, obviously. So what is the best way to hydrate the face, the body, your hands, especially right now with all the chafing and dryness from so much hand sanitizer and washing, and also the neck?
Sure. So I'll speak for a quick moment about hand washing because that's one of the other common skin issues that we're seeing now, especially in the midst of this pandemic. We have to wash our hands. You have to wash your hands for at least 20 seconds in lukewarm water with a gentle cleanser for protection. But excessive washing of the hands can lead to excessive dryness. And add hand sanitizers to that, and it even makes it worse. So the key about washing, whether it's your face or your hands, is to wash with a gentle cleanser, gentle fragrance-free. Again, I have some examples here for the hands. There's these little sensitive skin, like Dove sensitive skin. Soap is very nice for the hands. And after you wash, while your hands are still damp, you don't want to fully dry them. While they're still damp, you want to apply a moisturizer or a barrier cream for your hands. And similarly for your face, but nothing too thick for your face. One of the hand creams that I really like a lot is made by Neutrogena, and it's just simple Neutrogena hand cream. And you'll notice most of the creams that are most effective, they don't come in a bottle with a pump, they come in a tube, and they're more thick, and they really feel like a barrier is being applied to your hands. By applying the lotion or
Are they all hypoallergenic?
You want to look for fragrance-free, hypoallergenic, of course. But the key is to seal the moisture in. And in some cases where you have really excessive dryness, you can add cotton gloves. If you can buy them at the drugstore, 100% cotton gloves, and you can put the gloves on top of the moisturizer that you applied on your hands. It'll help seal it in, and you can sleep with those gloves on overnight. If you can't find cotton gloves, some people just put cotton socks on. But the key is gentle, short, washing, obviously at least 20 seconds with lukewarm water with a gentle cleanser, and then to apply the moisturizer and to seal it in, to seal the moisture in. As you mentioned, you can't really drink water into your skin. Obviously, drinking water is good for your system as a whole, but it does flush out through your body. So drinking water is good, but the best way to seal the moisture in is, as I just mentioned, with gentle cleansers and moisturizers.
Hi, Carol. So someone is asking, I guess this applies to face cream. Do creams with botanical stem cells have any value? Mona's asking that.
So there's a lot of controversy over botanicals in general in any type of cream. Generally speaking, the less that's in your moisturizer, I believe, is best. Some botanicals, even though they're all natural, can cause contact or allergic dermatitis. Some people come in and say, oh, I use tea tree oil or I use lavender oil. It's all natural. And jokingly, I'll say, well, poison ivy is all natural as well, because there are botanicals that exist in our environment that, although they are all natural, may not agree with your skin. And that's really on a case-by-case basis. Some people can have an allergy to tea tree oil. I see that quite a bit. Some people can have an allergy to lavender oil. So I'm very cautious with botanicals because you can't predict who will and who won't have a reaction to it. I think the less ingredients you put into your moisturizers, the better. Something that acts as a barrier. A very simple one, this is another product and probably the last I'll show, is Aquaphor. We've all used this. If you have kids, I'm sure you all have used Aquaphor for your kids' skin at some point. Aquaphor is a wonderful barrier because it has very little in it, and it can really help seal in moisture. The concept of stem cells and other products in over-the-counter moisturizers is also interesting because although there is data to show that certain ingredients, whether it be stem cells or certain vitamins or antioxidants are effective in helping the skin, it really depends upon the concentration that is in the product. And there are restrictions that the FDA has on the concentrations you can put into an over-the-counter product. So although it may have something that we know helps, it doesn't really have enough of that to make a difference. So it won't necessarily hurt, but we can't say with certainty that it will make a big difference.
What is the best cream? Miriam is asking, what is the best neck cream for crepey skin?
I wouldn't say that there's one best cream. I think you want to look for a cream that's not going to have anything too irritating in it. Sometimes people buy salicylic acid creams or benzoyl peroxide or vitamin C. There's a whole array of different ingredients that can be in a moisturizing cream. I really like to keep it very simple. Fragrance-free, hypoallergenic, Cetaphil. CeraVe makes a very good line of products over the counter as well because they all contain ceramides, and ceramides are very good for sealing in moisture and helping the skin retain its hydration. There are really no over-the-counter creams that are going to change the texture dramatically of your skin, but by hydrating your skin properly, protecting it from the sun, you always want to have an SPF and a moisturizer. That's very, very important if possible. An SPF.
All day long, do you just put the SPF in the areas that are surrounding the mask so that you don't get a moisture retention under the mask of SPF?
I think if you're using a moisturizer on your face, you should apply it to the entire face, and it should be one that has an SPF in it, so that it can protect the entire face. It's hard also to really know where you're going to have the cutoff. You don't want to get a sunburn in any way on it or a line in any way, so you really want to make sure you're completely protected. So
there's this surgery called Mohs surgery. Can you tell me what it's used for and why is it so popular right now?
So yeah, we can switch to talk a little bit about skin cancer in general. As you know, skin cancer, the most common type of skin cancer is the most common cancer in this country. It's called basal cell carcinoma. I like to break skin cancers into two families, the melanoma family and the non-melanoma family. The melanoma family can be very, very serious. That's the type of skin cancer that has a genetic predisposition associated with it, as well as influences from exposure to the sun over time. Certain skin types are more predisposed to it, and that can be very serious and threatening, and can spread internally. And so that's very important to be checked for annually to make sure that none of your brown spots or moles are changing. But the more common types of skin cancers that we see very, very commonly are the non-melanoma skin cancers. And the two most common types are called basal cell carcinoma and squamous cell carcinoma. And the names that we attribute to these cancers derive from the cells from where they come. So basal cell carcinoma and squamous cell carcinoma generally evolve through a lifetime of sun exposure in various parts of the body. And some people are more predisposed than others. Very fair-skinned individuals are obviously more predisposed to that. And these are skin cancers that don't tend to spread or travel inside the body readily. They're very slow growing. They are, however, malignancies. They just don't metastasize. So when people get these types of skin cancers, specifically in areas like the head and neck, the hands, or the legs, areas where preservation of the normal skin surrounding is very important, we use a procedure called Mohs surgery. And Mohs is spelled M-O-H-S. It's actually named after Dr. Frederick Mohs, who came up with the concept many years ago. And to simply explain it, it's a procedure that involves using the microscope as well as excision. So what we're trying to do with Mohs surgery is remove the entirety of the skin cancer. Skin cancers have a visible part and a non-visible part. So it's kind of like a tree. If you cut a tree at the ground, the stump is there, but we all know roots exist under the ground. Similarly, skin cancers have roots under the skin. So what we do is we use the microscope to take out a little piece of tissue, check it under the microscope. We make a slide in the office while the patient waits, and we can see if the borders are free of the skin cancer. And if they're not, we can see where the skin cancer cells are on the slide, correlate it precisely to where it is on the skin, go back only to the affected area and remove another piece and check it again. So it allows us to have a very precise removal of the skin cancer while making the wound or hole that we create very, very small, which in turn means the smallest scar. So basically, highest cure, smallest scar. That's the effect and the benefit of using Mohs surgery.
So, in an effort to avoid getting skin cancer, someone is asking, Juliana is asking about tinted SPFs. Are they effective, and are they bad for you?
So many people like to use a tinted SPF kind of in place of a makeup, which is very, very useful and a good idea. As long as it's obviously a reliable sunscreen manufacturer that's making an SPF that has to comply with FDA rules. There are very strict FDA rules on sunscreen and their SPF. So if they're marketed and sold and they say SPF 30, they have to be SPF 30. The tint just allows someone to use that instead of having to have multiple layers of sunscreen and then makeup. And I know many people who really like to just use that as their makeup and their kind of moisturizer sunscreen at the same time. So they are effective and safe.
So let's talk about retinoids for a minute. Retin-A, et cetera. What is their efficacy? Obviously, they prevent acne. But do they turn back sun exposure? And what are the topical ones that are most important to use?
Great question. So to understand how retinoids work, I'm going to just speak for a minute about how our skin regenerates and how the cycle of skin exists. Every 2 to 3 months, we make a new layer of skin. And normally, when we're very young, that top layer of skin should naturally exfoliate as a new layer comes in. Mm-hmm. As time goes and we get older, that cycle doesn't function the same way, or if we've had excessive sun damage over time throughout our life, the cycle doesn't function the same way. And sometimes even hormones can affect how that cycle runs. And so how your skin regenerates in cycles can cause acne, sun damage, predispose you to skin cancer. So how do we regulate that? Well, retinoids have been known for many, many years to regulate and sort of reprogram how your skin cycles. Retinoids are derived from vitamin A, and there are topical retinoids, and there are also oral retinoids. Retin-A is the most famous. It's been out since the 1980s, and it has been used, yes, for acne, but also for the prevention of skin cancer and for sun damage and for anti-aging. Retinoids reprogram the way your skin cycles. It helps the natural exfoliation of your skin so you don't have to scrub and rub.
So
and
instead of
it also
exfoliator, you recommend the retinoid instead?
Well, I'll get to that. Yeah, the other thing that retinoids also do, though, that's very important is they remodel the collagen and reprogram how the structural proteins of your skin regenerate. So it causes a strengthening of the collagen under the skin. When you ask about scrubbing, a lot of people like to use buff puffs or Clarisonic brushes or things like that to scrub the skin. You know, there is benefit to getting exfoliation of your skin, but sometimes the mechanical exfoliation can actually be more damaging than good. And I'll come all the way back to the beginning of our discussion with acne mechanica. Friction and rubbing can irritate the oil glands and in some people cause an excess of oil production. So if you can do something, for example, use glycolic acid pads that they sell over the counter to wipe your face down. The acid there will loosen up the dead skin. Retinoids like Retin-A or Differin can help loosen up that dead skin and help reprogram how the skin cycles. Chemical peels you can get either at a spa or a doctor's office can also help do that as well. There's an over-the-counter retinoid. It used to be prescription, but now it's over-the-counter. It's called Differin. The generic name is adapalene, but Differin, D-I-F-F-E-R-I-N. And the low strength of that, the 0.1% strength, is over-the-counter and available and useful to help with acne and anti-aging. The thing about retinoids is they can be very irritating and drying if they're not used properly. They should be applied in a pea-sized amount.
How often do you apply it?
So the proper way to use a retinoid is to take a pea-sized amount, literally a pea-sized amount, and the way you would put a foundation of makeup, dab, 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 go back and rub it on and leave it on and apply a moisturizer on top of it. Ideally, using it every night would be beneficial. However, some people can't tolerate that, so they have to do it every other night or every few nights. It's not something you want to use if you're a woman who's trying to get pregnant or is pregnant. You can't use topical retinoids. However, it's very effective for all the issues I previously discussed.
Are there any clean Retin-A recommendations that you have,
I'm
Margaret?
sorry?
Any clean, meaning non-toxic Retin-A recommendations? I guess that's sort of it.
So all retinoids are similar in how they work. None of them are necessarily toxic. It's just vitamin A derivatives are contraindicated in pregnancy or women trying to get pregnant. But there's not that one that's more toxic or less toxic. None of them are toxic. They're just different efficacies based on their concentration and strength.
So you mentioned, mechanical exfoliation clogs the pores, but it also creates red capillaries, which are more, around the nose area and such. So your suggestion is to keep it simple, right?
Yeah. Yes.
Three things you should be doing: the cleansers, the moisturizing, and the sunscreen.
That's right.
You apply a retinoid into your moisturizing protocol, then you should do that, correct?
So you got it exactly right, Cristina. You have a gentle cleanser, a moisturizer, and a sunscreen should be every day. And the thing about sunscreen, especially if you're going to be outdoors, one application of sunscreen in the morning is not going to be enough. If you're going to spend a day at the park, at the beach, out playing tennis, you're going to want to reapply that sunscreen liberally every hour or two, especially when you come out of the water. Even if it says water resistant or waterproof, you want to make sure that it's reapplied because it does come off. As far as retinoids, those are very effective, especially more the winter, fall, spring months. In the summertime, they can make you a little sun sensitive. And now, with everyone wearing masks, we have to be a little more careful with retinoids, but normally, retinoids are very effective in helping maintain the health of your skin. Yes.
Right. So SPFs, just really quickly, when you have an SPF 30, what does that mean? SPF 45, does that mean it's going to last for on your skin and you should reapply 30 minutes later, or do you have a 3-hour window?
No. It just means it's going to take that much more time for you to get sunburned, the higher the SPF. So the higher the SPF, always the better, and but even with an SPF of 100, you still want to reapply it. The recommendations now are an SPF of 30 or higher, but it's more about how frequently and how much. I mean, you could go to the beach and use at least half a bottle of sunscreen, and that would be probably appropriate.
Okay, so Karen is asking, she says, I'm allergic to aloe and lavender. What can I use on my lips? I have been using Vaseline. I want something safe. Would that be Aquaphor? It's not the same?
Yeah, so that's a great question, because just integrating our discussion of sunscreen, a lot of times people forget about how important sunscreen is on parts of the body that we often forget, like the ears and the lips. So having a moisturizer or a lip balm that has a sunscreen in it is important. But just for dry, chapped lips, I think Aquaphor is really, really good. I like it a lot. It's very safe. It can be applied repeatedly, and I think it's a great moisturizer. There are a variety of different brands that make lip balms that have a sunscreen in them. And as long as it has an SPF, again, of 30 or higher, and it has some type of balmy effect when putting onto your lips, it's going to help protect.
Wanda is asking, do African Americans get skin cancer often?
It's a wonderful question. The answer is yes. All skin types can develop skin cancer. As I mentioned earlier, there are two families of skin cancer, melanoma and non-melanoma. All skin types can develop melanoma. Certain skin types, darker skin types, African American, Asian, Latin, when we see skin cancer that's melanoma, the more common areas that we'll see it actually are on the palms and the soles. So when we perform total body skin examinations on darker skin individuals, one thing that dermatologists will always spend extra time looking at is in between the toes. They should on everybody anyhow, but really close looking in between the fingers, on the palms, in between the toes, and on the feet. And we have a higher level of suspicion when we see a mole or a new evolving mole in those individuals. The non-melanoma skin cancers, such as basal cell and squamous cell, also can present themselves in darker skinned individuals. Sometimes that's seen in countries that are closer to the equator where there's a lot of sun exposure, and it can develop there as well. So the answer is yes, everyone should be checked head to toe.
So I know you're a Mohs surgeon, and that is your recommendation for skin cancer, but do things like lasers help treat skin cancer, like Clear and Brilliant, Permia, and Fraxel are some of the ones that I know people have been utilizing?
So, again, a very interesting question. Typically, the treatments for skin cancer most of the time are to either have them removed via a destructive method by scraping them, or by excising them, or by doing Mohs. There are some creams that do work. I'll touch for a moment on retinoids too. There are some oral retinoids that are taken by mouth to prevent skin cancer. As far as the treatment of skin cancer with lasers, many years ago there had been some studies that had shown that the carbon dioxide or CO2 lasers could burn them off the skin, but it wasn't a very effective method. Now back to specifically answer your question of Fraxel, Clear and Brilliant and Permea are more aesthetic lasers to help with anti-aging and the glow of your skin. Fraxel does the same. However, there are certain ways to use a Fraxel, and there's been data to support this, that by using the Fraxel with certain settings, you can cause enough of an exfoliation to get rid of some of the precancerous cells on your skin. And there are some people that go once or twice a year for an aggressive Fraxel treatment to their face. Some men do it just on their scalp if they don't have hair on their head, because the sun exposure there also causes problems. And people will go for either once or twice a year for an aggressive kind of deep laser peel to get rid of some of these precancerous lesions, but not really to treat skin cancer, but to prevent.
To prevent. So do these lasers also remove dark spots caused by the sun and also hyperpigmentation?
They do. So there's a whole array of different lasers. Lasers work on the premise of being of a certain wavelength, and that wavelength is like a guided missile for a target. So some people get broken blood vessels and redness on their skin, so we have lasers like a pulse dye laser that targets the redness on the skin. Other people have pigmented spots, freckles they want to get rid of, so we have lasers like that to remove those. Now, Fraxel is incredibly effective at doing multiple things, such as removing brown spots, evening skin tone, again, as I mentioned, preventing certain precancers from evolving, but also causing a deep collagen remodeling so that the next layer of skin that cycles in can be healthier and less sun damaged.
So when
the rule of thumb with laser, sorry.
Explain what collagen remodeling is. It's bringing it.
So every few months, as I mentioned, we make a new layer of skin. It's not just the top layer that's regenerating, it's the deeper layers as well. And in the deeper layers, that's where the scaffolding or the skeleton of our skin exists. And there are a variety of different proteins and acids that contribute to that, such as hyaluronic acid, collagen, elastin. What we want to do as we get older, the process of remodeling, the process of our skin regenerating isn't the same as it was when we were younger. So anything that can spark the cycling to restart, such as a laser treatment, will cause new and healthy collagen, new and healthy elastin. It helps make all these structural proteins grow back in a healthier way.
So Moon Blankets is asking about the Claronic or the Mia tools. How often is one better than the other? And I know you, Moon, we were talking about avoiding abrasive or mechanical exfoliators in favor of retinoids, because you want to just quickly mention again about clogging of the pores and also the damage to the skin that mechanical exfoliators create?
Sure. So I'll go back to that concept of the cycle of skin. If you picture that every 3 months a new layer of skin is supposed to naturally exfoliate, but that doesn't happen because we had sun damage or because our hormones are causing clogging of the pores, one thing we can get is acne, and oils build up. The naturally occurring bacteria in our skin can thrive and cause pimples and pustules. So if we can get a way to exfoliate our skin but without rubbing or being mechanically abrasive, we can get positive effect on our skin. Retinoids are very effective in doing that. Chemical peels are extremely effective in doing that. Glycolic acids and salicylic acid washes, masks, peels, pads, all of those are very effective in doing that because they loosen up the skin and let them naturally exfoliate. When you take something that's mechanical and you're rubbing and you're abrasive, there are many people who react in a way that their oil glands overproduce more oil, and you actually get a paradoxical worsening of your acne. Same with the back. Some people like to use a loofah to scrub their back. I see many people who do that, and they get a back acne effect from that. So I am not a big fan of using mechanical abrasive procedures. I recommend, again, at home they can use topical retinoids, come to the office for a peel. Those are the types of things that I think are more effective. And you mentioned also about mechanical abrasion. Mechanical abrasion can cause trauma to the skin. And back to your question about the blood vessels, it can cause new blood vessels and capillaries to grow. Just the trauma from the skin, your skin reacts by trying to feed new blood supply to it. That causes capillaries. So I've seen many people who have rosacea or acne who use these Clarisonic brushes and do not get the effect they want, but get an unwanted new layer of capillaries.
So I know that toner is also very effective as something to add into a routine after the cleansing, before the moisturizing, because you use a soft cotton pad, I think, to remove excess bacteria, excess dirt, correct?
So toners are interesting because there are many different products that can be used as a toner. The concept of a toner is something that's going to try to, as you say, take off some of the excess, whether it's makeup or oils. It's very helpful, but you don't want to use anything that's too irritating, something that has too much alcohol in it, for example, something that's going to suck the moisture out. You want something very, very gentle. I don't have a specific...
Something non-toxic.
Well, none of these are really toxic. It's just non-irritating. The toxic means, more of something that's a non-irritant. Things that have a lot of soap in them, things that have a lot of detergent or alcohol can be very irritating to the skin, and you want to avoid that. You want to use things that are very gentle, that can help just gently wipe off those products. Yeah. Sometimes we use topical antibiotics to treat acne. There are some topical antibiotic pads that are very effective as a toner. People carry them in their pocket or their purse, and they wipe their face down on a hot summer day to get the oils off, and it actually tones the skin.
I know we mentioned topical antibiotics before because of this maskne, this acne that's happening by wearing masks excessively, but you don't want to apply Neosporin to your acne because of the level of oil, correct? I mean, isn't that just going to...
Correct. So when I'm talking about topical antibiotics, I'm not talking about over-the-counter antibiotics that you would put on a wound. I'm talking about prescription topicals that are used to treat acne that you would get from a dermatologist. For example, there's one called clindamycin, erythromycin, things like that. Those are safe and fine. In fact, if you develop significant acne from your mask, you would probably want to see a dermatologist and get a prescription for some topical clindamycin. If you do develop acne from the mask and you want to try something over-the-counter, there are some over-the-counter benzoyl peroxide preparations. 2.5% preparation is totally fine to use as a spot treatment, although it can be a little irritating. You'd use it gently to treat some pimples. But some people who get an actual irritant or allergic reaction to the mask might need something like a topical cortisone cream, like a very low strength, over-the-counter 1% hydrocortisone to help calm that down. I do not recommend putting Neosporin or bacitracin on the face or, frankly, anywhere else on the body because, interestingly, many people aren't aware of this. There's a very high incidence of allergy to Neosporin, triple antibiotic, and bacitracin. Almost up to 10% of the population of this country has a bacitracin allergy, meaning after repeated use, they develop a sensitivity. So I definitely would not put that on your face.
Okay, thank you for that. So Gigi, my friend Gigi, she said, my son has very fair skin. He gets freckles all over his nose and cheeks, even when she put an SPF of 50 on him. Why is this happening?
So there are genetic factors that play a role. It's not always just the sun. Very, very fair-skinned individuals, with or without sun, are going to develop more pigmented lesions than someone with darker skin. So there's a combination of factors. I think the best that we can do in any individual, especially in a child who's very fair skin, is to repeatedly apply sunscreen the highest you can, wear a hat, get sun protective clothes. If playing outdoors, make sure that they're being protected if possible in the shade, but if not, wearing clothing that covers their body, and again, a hat and sunscreen. And then monitoring, if new freckles come up or new moles come up, see a dermatologist once a year just to get checked. There's some things that are out of our control, and that's really just in the genes. But what you can control is the protection that you use for the sun on a daily basis.
So Clara is asking, how do I improve puffy eyes and dark circles?
That's one of the toughest problems to handle. So there are many creams out there that try to treat and handle dark circles and puffiness. One of the causes of puffiness under the eyes is multiple. We all have these natural little pads of fat that live under our eyes. And with time, in some people, those little pads can enlarge and cause puffiness. Sometimes the only solution would be something surgical if it's something that's aesthetically bothersome. However, in others, it just happens, on a very hot day or after certain very salty meals, etc. And people often would take spoons, put them in water, put them in the freezer overnight, and put a frozen spoon on your eye to kind of bring the swelling down. Some people just get swelling, like we call it edema, and other people get a chronic change in the anatomy under their eye. Dark circles are very hard to treat because some of the darkness is from the shadowing of the effects I just described. The most important things to do to take care of your under eye area is to moisturize regularly. I actually do like using something like Aquaphor, which is a greasy ointment, but it really does help and prevent some of the crepiness appearance that we see. And then there are a lot of antioxidant-containing products, specifically vitamin C, that can help with lessening some of the appearance of these changes that we see. There's no one answer to it for everyone because it's different in everybody and presents differently. Some people get a hollowness under their eye, where we call it the tear trough, right under here, where there's a hollow effect, and they feel like they don't have enough fullness as compared to the outside part of the eye. In those situations, if someone wanted to do something cosmetic, they could have some what we call filler, for example, Restylane, injected into those areas in a very safe way without putting the needle right here. We use something called a cannula, where from out of the cheek over here, we can safely tunnel what's a non-sharp, meaning it's blunt, a blunt type of a needle that goes under here and places very safely a little filler to soften that depression that we see between the under eye area and the tear trough, or the part right by the nose where the nose meets the eye. So there's some procedures that can soften and improve the appearance. There's some creams that can help moisturize, and there's some topicals that have an antioxidant effect that are very helpful.
So someone's asking about the scalp. What do you recommend? I'm assuming she means a dry scalp.
So the most common condition that we see on the scalp is something called seborrheic dermatitis, which is a medical fancy term for dandruff. And that can come in many different varieties and various levels of aggressiveness. Some people just have some flaking. Other people can get areas that are more caked up. Some people who have a skin condition known as psoriasis. Psoriasis is a condition that often affects the elbows, knees, but it can affect the whole body, where the skin gets kind of thickened and heaped up. Some people get it just in the scalp. Regardless of the severity, there are a variety of over-the-counter products. The ones that I like very much, that are stronger than, for example, Head & Shoulders, are T-Gel and T-Sal, which are these shampoos made by Neutrogena. One's a tar-based, one's a salicylic acid-based. And if you mix them together and apply them into the scalp for maybe 5 or 10 minutes and do it 2 or 3 times a week, it can help loosen up a lot of the caked up flakiness. If you're just having a little bit of flakiness and dryness, Selsun Blue, Head & Shoulders are all very effective. If it's not responding to the over-the-counter products, there's a whole array of topical shampoos and topical applications that your dermatologist can advise and prescribe for you that are very effective. The key thing to understand, it's a chronic condition, so it's not curable necessarily, but it is controllable.
So what do you recommend when you're doing peels and you have some irritation or skin redness?
So after a peel or a laser treatment, laser treatments aren't they don't have to be very aggressive. For example, we talked about Clear and Brilliant. I'll show you. This is the Clear and Brilliant handpiece. It's a small little handpiece that rubs across the skin. Most lasers do the same type of procedure where they rub back and forth, or some of them shoot a light out, and they can cause a lot of redness. And if you're doing one of the lesser aggressive ones, like the Clear and Brilliant or the Permea, you'll have some short-lived redness that can easily be controlled with a mild topical cortisone, like a hydrocortisone 1%, that can be applied maybe once after the treatment, but not more. And then just using a good moisturizer that is, as we described earlier, fragrance-free with a ceramide type ingredient will give you a lot of effectiveness in terms of reducing the redness, and then the redness should go away.
What about blue and red light therapy? What are your thoughts on that?
So blue and red light therapy, there's a whole array of uses for that. The most common and the original uses for that was for the treatment of people who had precancerous spots on large areas of their skin, specifically their face. Those therapies were used in conjunction with a topical applicator of a solution called aminolevulanic acid, or ALA for short. And what we would do is we would paint the skin with this applicator of ALA. The bad cells, the precancer cells, would soak it up like a magnet, and then we would shine these lights, either blue or red, onto those areas to destroy and remove the precancer skin. Now, blue and red light have come out in a whole array of different products. People can buy over-the-counter, light treatments to try and help their hair grow or for their face. I think it really comes down to the strength of the light, the individual skin type, and what you're trying to achieve. So I think there are uses for it, but again, it's a case-by-case scenario where you really have to apply it to the right situation.
So someone said you recommend a face wash. It's Cetaphil, correct? Something you like?
Oh, I like, anything that has ceramides. I like Cetaphil and CeraVe. They're very gentle and very simple, and they're not going to irritate you. I'm sorry?
Carol's asking, microneedling wands at home, bad or good?
So microneedling, just to explain what that is. Microneedling has been around for a long time, but it's had a new resurgence over the past number of years to try to give similar results to what some of the lasers like Fraxel could do. The concept is there are these little tiny needles that gently hit the skin to cause very controlled micro wounds. Again, trying to induce new collagen production, help get rid of pigment. We use them in the office with a more aggressive wand, and sometimes we use it with something that's called PRP, or platelet-rich plasma, which is where we draw the patient's own blood, draw the patient's own blood, spin it down, and take the platelet-rich portion and apply it to the skin while doing the microneedling. Some people have labeled this as the vampire facial. You may have heard or read about that. But microneedling is very effective for things like acne scars, skin regeneration, and pigment. The home use ones are not as aggressive and not as deep. So there's no harm as long as you're careful and you're not using it too aggressively in using those. But I think if you really want to get an effect, having it done by a dermatologist or healthcare professional in the proper way is going to give you a much more effective result.
So what about dermaplaning?
Dermaplaning, I don't have anything necessarily negative to say. I don't have anything very positive to say. I think it's another technique procedure that people are doing that can have some effect, but it's just another one of the newer procedures out there that hasn't shown as much promise as the ones we've discussed, such as lasering and microneedling and peels and such. But I'm not set on it one way or the other.
And Stacy's asking about witch hazel and white vinegar. What are they good for, and are they effective?
So witch hazel is very soothing. Some people like using witch hazel pads or witch hazel on mosquito bites, for example, or sunburns and skin irritations. It's been very soothing, and there's nothing but good that can come from it because it helps make the skin feel better and can help reduce some inflammation. Vinegar, the most common thing I think we use vinegar for in dermatology is people who get certain types of fungal infections on the nails or bacterial infections under the nail from either a manicure or a nail that got kind of cut the wrong way. Soaking your finger in white vinegar can help. White vinegar and water can help reduce the bacteria and fungus and help that heal more quickly. But that's really the most common use for that.
So what are flat white spots on the body? What is that a sign of? And what can you treat?
That's a very broad question. I can give you a list of 10 things that could be flat white spots. I think what that person might be referring to, my guess would be, the most common thing that we see is something called tinea versicolor. Tinea versicolor is commonly seen on the chest and upper back. And depending on the skin type, it can be flat white spots, or in darker skins, in lighter skin, it can be flat dark spots. So it varies on the skin type. It's a naturally occurring fungus that lives in all of our skin. It's not contagious. You can't give it to someone. You can't get it from someone. But it's a little spore that lives in our oil glands that when it gets hot, the sweat and the oil brings it up and it causes a change of the skin, hence the name versicolor, tinea versicolor. Typically, I'll tell someone to get Selsun Blue or Head & Shoulders, use it as a liquid soap on their body for about 5 minutes, wash it off. Sometimes we have to use a prescription topical as well. The other white spots, there are more other conditions that can cause white spots, such as vitiligo and such, but it really depends on the type of white spot.
Maria's asking any recommendations for men's ingrown facial hair, especially for dark skin.
Yes. So one of the issues with ingrown hairs on the face, especially in dark skin, is that even if you can control it and get it better, the hyperpigmentation or darkness can persist for a long time. So depending on the coarseness of an individual's facial hair, it can be challenging to treat. The first thing I recommend, simple, over the counter, is to get a benzoyl peroxide cleanser, 2.5% or 5%, and to buy some Aveeno brand shaving cream. Apply the cleanser, put the shaving cream on top, and shave with the grain, never against the grain. When you shave against the grain, you irritate the follicle, and it can curl inside itself and cause a pimple. If it's not responding or getting better from that, then you should see a dermatologist to get a topical antibiotic lotion like clindamycin, which can help reduce the swelling. Sometimes some of the pimples can actually be injected with a little bit of cortisone, which we do for pimples commonly in the office. Lastly, some people actually get laser-assisted hair removal on the face, not to stop the hair growth, but just at a very low level to make the hairs grow thin and straight rather than coarse and curly.
Skin tags. What can be done to get rid of those?
Skin tags are commonly seen in areas where skin rubs against skin. So under the arms, sometimes in the groin area, and most commonly on the neck. And on the neck, it's from friction of clothing or jewelry that causes it. Oh. They can also be genetic. They're benign. They're just basically these little extra pedunculated areas of skin. And if they're small enough, they can be cauterized off and they fall off on their own. If they're larger, we can numb the area, use an instrument to remove it, and then cauterize the area. There's nothing to do to prevent it other than not allowing for the friction, so less jewelry, looser fitting clothes, but removing them is very simple and easy.
Is there, stress on the skin, physical, emotional, quarantine stress? What can be done to offset that?
There's definitely what we like to call a brain-skin connection. And whether it's physical or emotional stress, stress plays a big, big role on the skin. Stress causes cortisol and cortisone-releasing hormones to come out, which can affect the internal organs, but can also affect your skin. It can cause acne. If you have psoriasis or eczema, it can flare that. If you have the seborrheic dermatitis we talked about on the scalp, or some people get it on their face, it can affect that. So we know that it has a large effect on the skin. The number one issue really obviously is to reduce that stress. If it's a physical stress, sometimes it just takes time to recover. Hair loss can occur. There's a stress-induced hair loss that occurs in many people as well. Again, relieving the stress is the number one issue, and treating the underlying conditions, depending on what it is the other issue.
So, and is an SPF 100 too stressful on the skin? The higher the SPF?
No. The SPF doesn't have any effect of stress on the skin. When I'm talking, the stress on the skin, a lot of it is either emotional or physical, but there's no The SPF of 100 is not going to, as long as the base is gentle, is totally fine and safe.
Some people put vitamin C oils on their skin. Are they an effective topical vitamin?
So there are a number of vitamins, including vitamin C, which are known as antioxidants, that are very effective in helping skin regeneration, the skin cycles, collagen remodeling. That's been proven both in a lab and also clinically. It depends on the product and the concentration of the vitamin C. So there are a number of products that are sold only in doctors' offices that have a higher concentration, and there's a number that are over the counter. It's definitely beneficial for your skin. The key is, are you getting enough of it in your product?
Okay, so Chelsea's asking, she says she mixes water and apple cider vinegar to help her itchy scalp because it regulates the pH level. Is that okay for itchy scalp for kids too?
So the reason people get itchy scalp is there's usually an excess of oil production. And so it's controversial as to what the cause is. Is it something that is a pH-related issue, or we all have these natural spores and such that live in our skin and in our oil gland, and sometimes they can overgrow and cause excess oil production. My recommendation when you have itchy scalp is to use, as I mentioned earlier, some of the over-the-counter anti-dandruff shampoos such as Head & Shoulders or Selsun Blue, or if it's really irritating, the stronger ones that have the tar or the salicylic acid in them. However, there are some topical prescription medicines that can also help. As far as using vinegar and water, I don't think there's enough data in the literature to support its efficacy. So I can't say that it definitely works, but if someone's having success with it and it's not irritating their hair, I don't think there's an issue with that.
Yeah, I think all natural treatments should be treated the same way. If you're having success with it, you keep doing it. Karen's asking about scars. What can you do to reduce scars on your body?
So it depends on the type of scars. If it's a scar from a surgery, there are a variety of treatments, which include certain types of injections to the scar to soften them. And then there are a variety of laser treatments, again, Fraxel being one of them, the pulse dye laser being another one, which can help reduce redness and smoothen out the scar. Some people talk about hyperpigmentation being a scar, meaning discoloration. For example, it's healed, but there's a darkness to it.
Like a stretch mark?
I'm sorry?
Like a stretch mark?
No, that's different. That's another thing I'll discuss in a moment. But the darker spots are a little harder to treat. Some people have acne scars, and there's a whole array of both laser and injectable treatments to treat those. Stretch marks are challenging. Stretch marks are basically a type of scar, but it's a stretched out scar. We do use lasers to try to reduce the appearance of those. There's some other devices that help rebuild collagen. Radio frequency devices, those are a new category of devices that have been out over the last decade. And actually, retinoids have been used for many years, back to Retin-A. People put Retin-A on their stretch marks, and it does help the appearance of those. So there's a whole array. It really depends on the type of scar, the location, and actually, very importantly, too, the skin type.
So, so many questions, Doctor. You're very popular today.
Keep them coming.
Someone's asking, Yasmin is asking, I have red spots under my skin, all over my arms and legs. How can I get rid of them?
So the most common type of red spots that we see are called cherry angiomas. They're little red dots. If that's what she's talking about, they are benign, generally speaking, and there are lasers that we have that can remove them. There's a variety of different lasers that target redness. If the red spots are different, it really depends on what kind of red spots they are. Is this something that's been there for a long time? Is it a new onset? Some history can help figure out what the best course would be, but if they have been there for a while and they're little red dots, we have lasers that you use to treat them.
Are they capillaries, and the lasers just break them up and spread them out?
You can think of them as a grouping, like a little broken capillary, and the laser doesn't spread them out. The laser targets the red blood cells in them, and the energy from the laser in the form of light makes them turn bruised color, and then they just dissolve away.
And what about age spots on legs and arms and hands?
Similarly, going from topicals to peels to lasers, there's a whole array of treatments. Realistically, on the hands, arms, and legs, lasers are the number of those brown spots.
Sorry, we lost you for a second. So
I'm sorry.
someone's asking about brightening the bikini area from shaving, from discoloration.
Right. So that's a constant issue for many people because similar to what we talked about earlier with the men's beard area, when you shave the area, you can make the hairs go kind of back inside and cause an ingrown hair. And then from that, if you're darker skinned, it can leave a discoloration. So it's a challenging area, but I will tell you the number one way to deal with bikini hair really is laser-assisted hair removal. It's not a cure. It's a maintenance type of treatment. So you do a series of treatments, maybe 3 to 5 treatments separated by about a month. And then you do them as needed every few months. And what that does is it allows the hairs to dissolve away. It makes the hairs that come back more wispy and thin. And you can avoid developing the inflammation from shaving, which is the inflammation is what causes the discoloration.
Right.
Treating the discoloration, there are some fading creams that can help. There's some topical prescription antibiotics that can help reduce the pimpling. But to prevent it from happening, I always recommend laser-assisted hair removal if the patient's a candidate.
Someone's asking if hair dye harms the skin.
Great question. So the problem with hair dye is specific to an individual. The main ingredient of most hair dyes is a chemical that has a long fancy name called paraphenylene diamine, or PPD for short. PPD is the cause of allergic reactions in hair dye. So if someone dyes their hair, and it's not something you're born with, you develop these allergies through exposure over time. Similarly, I'll talk about poison ivy for a quick second. The first time someone touches poison ivy, they don't get the rash. It's the second or third time because their skin had been exposed to it and it reacts to it after a subsequent exposure. Some people can dye their hair for 30 years and then, for whatever reason, develop an allergy. But what they're getting an allergy to is something called PPD. PPD is also the main ingredient in some of the henna tattoos you might see at a carnival or an amusement park, and some people get allergies to those, and they're very severe. So PPD is the thing you want to avoid if you have an allergy to hair dye. Some people just like to avoid it altogether. There's a brand called Illumin, E-L-U-M-E-N, Illumin, that makes a whole array of hair dyes of various colors that are PPD-free. So if someone's worried about developing an allergy, you can look it up online, Illumin hair dye.
So Wanda says, I have discoid lupus. Should I be using certain cleansers?
Discoid lupus, just to explain what that is. Lupus is an autoimmune disease, and there are various forms. Some are internal, some are external just on the skin. Discoid lupus is a type of lupus that affects the skin. Typically, it can affect just the skin and have no effect on the inside. The things to understand about discoid lupus that are very important is the sun flares it and aggravates it. So using a moisturizer with a very strong sunscreen, a specific cleanser, just gentle cleansers again. I wouldn't use anything aggressive because discoid lupus can lead to scarring, so you wouldn't want to do anything that would irritate the skin or cause a hyperpigmentation or a hypo, meaning a lightening pigmentation of the skin. So gentle, 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 and as much sunscreen as you can put on again and again and again. There are medical treatments too for that, obviously, which I'm sure her physician has discussed, if not already started.
Thank you. I also wanted to go back to the vitamin C question because there were a few add-ons to that. Is vitamin C with ferulic acid good, and what percentage of vitamin C should topical have to be optimal?
It's a good question. I think it's more by the there's not a set percentage that has been documented to say, oh, above this percentage it's going to work better than this percentage. It's just certain formulations. For example, SkinCeuticals, you may have heard of. They've been around for a long, long time. They make a whole array of vitamin C products. Their line is probably one of the best vitamin C products that exists, SkinCeuticals. There are some other, there's a company called Skin Better Science that makes a antioxidant line that has a combination of vitamin C and other antioxidants and the acid you're discussing that is also effective. I think it comes down to the manufacturer and the brand, rather than a set number percentage, because it's hard to say 35% versus 10% versus whatever it may be is going to be more effective. In general, the over-the-counter products do not have the same level as the ones that have been tested. In other words, the data that we have and the literature that we have on the efficacy of vitamin C is based on the products that are not over-the-counter. So none of the over-the-counter ones are going to have enough as the ones that I've just described, like SkinCeuticals. But they're not going to hurt. You just need to get the stronger manufacturers.
Judy was asking about cellulite, and maybe the same thing applies to stretch marks. What can be done about cellulite and stretch marks?
So cellulite is very different. Cellulite is actually where the fatty tissue can grow into the skin. Almost, if you can picture the inside of a cave, there are stalactites and stalagmites that come from the top and the bottom. Cellulite is basically stalactites and stalagmites of fat that go into the skin. So they're very hard to remove, and that fat causes a dimpling. Now, there are a whole array of procedures, VeloShape and these vacuum-like procedures that people have used, saying blood flow helps get rid of it, and there's some efficacy to that, and I think there are in-office procedures that can help. There's one procedure, it's called Selfina, which is incredibly effective at getting rid of the dimpling. It's a procedure that is not really very invasive, but involves loosening the bands of tissue that cause the dimples to be pulled down into the skin. As far as topicals, not very much. Other people have been, sorry?
They're not effective, topicals?
No, there's no topical effective for some. I mean, I don't mean to be so strong about it, but I can tell you there's no data to strongly support topicals in treating cellulite. There are procedures that have shown efficacy, and I think that's the best option if you're going to invest time and resources into doing something for that.
Julie said she lost 80 pounds now. The stretch marks are so itchy and uncomfortable.
So the itchiness can be relieved with topical anti-inflammatories like hydrocortisone or stronger prescription versions. The problem is you don't want to use cortisone on a stretch mark for a long time because cortisones themselves can aggravate or even cause more stretch marks. Mm-hmm. If there is excess skin that is there from having lost a certain amount of weight, visiting a surgeon to consider possibly having some of that skin removed might be an option. If the stretch marks are really bothersome, as I mentioned earlier, there are a variety of laser treatments that can help make them look less thin, strengthen them, and help the overall appearance. So I think lasers and possible surgery, if necessary, can be used to help that. But just for the itch, over-the-counter hydrocortisone 1% can relieve it, but I wouldn't use that for more than a week or 10 days because it can make things worse.
So let's talk about warts. Elizabeth says, can you ask efficient treatment for warts because they are so annoying to get rid of, old ones, and no efficient medical treatment I have found.
So there's a whole array of warts as well. I'm going to assume they're talking about warts like on the feet, or some people get them on the hands. There are warts that kids get too, something called molluscum, which I'm not going to discuss, but that's another type of common wart that goes away on its own. Warts on the hands and feet are truly a challenge, and it's interesting that you bring that up because there's a specific procedure that I perform that I get a lot of referrals for because normally we use something called liquid nitrogen, which if you've been to the dermatologist, they have this canister and it sprays out a very cold spray, and what it does is it burns off or causes a little blister for the wart to fall off. But on parts of the body where the warts live, like on the hands and feet, where the skin is so thick, it can't penetrate deep enough, and it's just months and months of treatment without getting an effect. There have been some other treatment options. People have talked about using lasers, but the data is not very strong for that in the literature. There's another treatment where people use what's called Candida antibody, where they actually inject a type of yeast into the wart to try to have your body's immune system fight it off, and that has mixed results. What I use with excellent efficacy, and I've even published literature on this in the dermatologic surgery literature, is something called injectable or intralesional bleomycin. Bleomycin was used for many years as a chemotherapeutic agent to treat various internal issues. But when used just into the skin, it's incredibly effective at getting to the layer where the virus that causes the wart lives and making those virus-infected cells die off and dissolve away. It does require a few treatments. It can be a little uncomfortable both during and the next day, but it's incredibly effective and one of the best treatment options to get rid of warts. People have tried these wart pads or filing them down. Unfortunately, the roots of these are so deep that it's very hard to get to the bottom of it without doing something like I just described, the intralesional bleomycin.
Okay.
Sorry.
I got warts for my entire teenage years into college, and I did just about every burning off of warts with different doctors, and the nitrogen, liquid nitrogen, they'd burn off, they'd grow back. I
Yep.
had them on my knees and my feet. And I had a friend who took her son to be treated for something at the Cleveland Clinic, and while he was there, they discussed his wart issue. They gave him a medication, which was Tagamet,
Yep.
used for
Yep.
something else. And it what happens is the acid levels in the system, the pH balance is completely off. So the warts can just grow and fester and live and survive. So I took the Tagamet, and 8 days later, my warts disappeared. It was crazy, the success of that. So I was so appreciative of my friend who had to go all the way to the Cleveland Clinic to have her son's warts eradicated that way. But it worked for me. My son has them on his feet. The problem with him, and it's a different experiment, is that he won't take it every day. You know, did you take your Tagamet? I forgot. You know, so if you're not being super diligent about it, it's not going to be effective. But I found that to be the way all my warts. What do you think about that, Doc?
Yeah. So Tagamet is the generic name is cimetidine. Has been very well documented in the literature, mostly in kids, frankly, because what happens, warts happen because of our immune system, and a kid's immune system or child's immune system is different than an adult. But everyone's immune system is different. So how your immune system can shed off the wart varies. Some people have warts and they just go away on their own because their immune system changes. But cimetidine has been shown, as you mentioned, to be very effective. Typically, it's in a much higher dose than you would take. You know, cimetidine is used for reflux and GI issues. It's given in a much higher dose when you're trying to treat warts. And it's a very good alternative, mostly for kids. So when I mentioned earlier that there are warts that kids get, like molluscum and others, it's a different approach than what I just described. I think it's very effective. I think it's worth a try. You're lucky because typically it's not as effective in adults as it would be in children. And that's why I mentioned this other treatment, because I've had people come in, again, they've tried everything and everything and everything, and this injectable medicine makes them go away. But if you can get a result with the Tagamet, I would totally encourage that. But you're lucky because, as I said, it's more effective in children than adults. And it's safe. It's just, it can give some people a little GI upset. That's the one thing to be aware of.
Right. Well, I was in my 20s.
Oh, okay. Oh, you were, yeah, okay, fine, yeah.
3 more questions because we've gone way over time, because this is all so fascinating.
This is fun. I'm loving it. It's great.
Carmen's asking about whiteheads and blackheads and how to remove them and what can be applied to prevent them.
So we're going to go back to the acne discussion. Whiteheads and blackheads occur because of that skin cycling, skin regeneration issue. The top layer is not properly coming off or exfoliating. It clogs the pores. The oils build up, and especially in a young woman, hormone changes cause excess oil production. And then the naturally occurring bacteria can thrive and cause pimples. If you can stop blackheads and whiteheads, you won't get the pimples and the worse acne later. Retinoids are really the #1 topical to help prevent whiteheads and blackheads. If you don't want to go to a dermatologist, the Differin 0.1% cream that I mentioned that's over the counter is effective, a little irritating, so used in small amounts. As far as getting them cleaned out, some people like to go for a facial to get them taken out. Some people go to the dermatologist, and we have a little instrument where we can open them and clear them out. Glycolic acid washes, glycolic acid peels will help loosen up the skin and reduce them as well. There's a whole array of treatments over the counter as well as in the doctor's office that can work. But I would recommend a retinoid and some glycolic acid cleanser, and that would be a good start.
So Louise is asking about the skin loosening around the jaw and what could be done about that. And it reminds me of our conversation about Ulthera. Is that a tightening solution effective?
Okay, so what happens over time is, unfortunately, Mother Nature lets our jowls and our skin kind of droop a little bit, and gravity pulls down. But we still have muscles here in the neck, and on top of those muscles is a lining. And so one thing I'll talk about before Ulthera, I will mention some people have used, and I do it very frequently, injectable Botox into the muscle in the center part, just superficially in the skin. And it allows for these outside muscles to lift up and pull. And I have many patients who come in, do a little Botox in the neck, and it gives them a lift right under their chin, and it's effective for about 4 months. And they come in every 4 months to do that. But for a longer lasting effect, Ulthera is a procedure that uses ultrasound. It uses the heat from ultrasound to penetrate specifically to the layer where the muscle lives, and it tightens up that lining of the muscle. It's actually the same layer that when someone goes in for plastic surgery for a facelift that gets lifted and tightened, that's the same layer we're targeting. And the Ulthera causes a very controlled warming of that layer, which over the next 90 days after the procedure causes a contraction of that layer and a tightening and lifting both here of the neck. Some people do it here to get a little bit of a jowl lift. Some people even do the brow to get a little bit of a brow lift. So I find it to be an effective, non-invasive alternative to a lift. By no means is it going to give the same effect as a lift surgically, but it gives a natural appearance because the tightening occurs around the natural contours of your own face and your own anatomy. So it gets a nice little lift this way.
And you just mentioned Botox. I'm sure a lot of people have questions about Botox. And is it bad in the long term? I know it's a purified toxin, so is it okay to take if you have allergies? The side effects,
Sure.
And what?
The Botox has been around since the mid-1980s. It was originally used in the ophthalmology world for people who have strabismus or where their eye is off to the side a little, and they get injections to soften that effect. We've used it cosmetically since the 80s to soften lines that come from movement, specifically the upper forehead. When you scrunch here, raise your eyebrows here, or on the sides, some people call it the crow's feet, and as I mentioned, the neck. We use it to soften those lines temporarily for about 4 months at a time. What it does is it softens the muscles that cause these angry frown lines or the unwanted crow's feet that we get over here. And it takes about a week for it to fully kick in and do its effect. But yes, it is safe. It's injected just into the muscle and not internally. You do not internalize the Botox in any way. It is a purified toxin, but it's not toxic to the body because the amount of Botox that would need to be systemically ingested, meaning inside your veins, is over 10,000 units, literally. The amount of Botox that we inject on a regular treatment is like 30 or 40 units total. So there's really no systemic danger there. There are some underlying conditions, specifically neuromuscular, something like myasthenia gravis, where people have these underlying neuromuscular conditions that Botox would be contraindicated because of muscle issues that can be associated. But as far as its overall safety, it's incredibly safe. The worst side effect associated with Botox is if somebody gets a little heaviness on their eyelid, which is temporary, and it happens less than 1% of the time, and it lasts for only a week or 2 weeks, depending on the individual, maybe a little bit longer.
It drops down versus lifting up.
Well, it depends on the individual. Some people have different sensitivities to it. The goal is to balance out the Botox so that the muscles here can lift up and not have this frown. Right. So that's the goal, is to lift up. But it's safe. Allergies to Botox are essentially non-existent. There are very few reports in the literature of adverse events to Botox, and about half of those reports were related to an underlying condition.
And what age should someone start applying or utilizing, injecting Botox?
It's a good question. People say, oh, I'm not ready yet, I'm not ready yet. I think once you start being able to, when you make these movements where you bring the eyes together or raise up and you start getting the lines that you can visibly see are being more pronounced, it's good to start considering it, because the more you make those movements, eventually the lines start being there without making the movements. So in a way, there's a preventative measure to it. By injecting Botox in these areas early on, I'm not going to give it age specifically. Some people start in their 30s, some people start in their 40s. Some people start even, depending, in their late 20s. But I think once you're in your 30s and 40s, these things start to be more pronounced. you can prevent them from being worse by doing a little Botox and, build up as you need to over time. The key about Botox, though, is you don't want to know that you had it done. You don't want to look frozen. You don't want to look like you can't make an expression. You want it to be natural looking, and there's definitely a way to achieve that, and that's obviously based on the person injecting it, looking and evaluating the individual. So there's a way to do it without even knowing you had it done.
And people use it to reduce the effects of, or rather the sweat glands, underarm. I know
We
some
do a
men
lot of that too. Yes.
have migraines, correct?
Right. So when people have excessive sweating, either on their underarm area or even their hands and feet, I treat those areas all the time as well. Botox works by blocking a signal from one nerve to the other. And the sweat glands that we have in our underarm area and our hands and our feet and our groin area are different than the sweat glands that we have on other parts of our body. And these types of sweat glands are very sensitive to reacting to Botox injections. So by injecting, it's a number of little injections, mind you, that on the underarms, it can give people 6 to 8 months of at least a 70 to 80% reduction in sweat. And for someone who's never had a problem with that, for the individuals that have what's called hyperhidrosis, which is what the condition's called, it can be incredibly uncomfortable and affect their lives adversely. Changing your shirt twice a day, being in a meeting, having sweat come out, it's life-changing for many, many people. Even with hands, occupationally, people who work with their hands, having reduced sweat makes a big difference. As far as migraines, it's used to inject into muscles that, migraines by definition typically are vascular changes on the inside or inside the skull. But around our skull, underneath the skin, are all these muscles that when they contract, they cause tension headaches. And by injecting some of those muscles and loosening those muscles up, you don't get that same amount of contraction and the headaches are reduced. So it's incredibly effective. Many neurologists do those treatments, and it's incredibly effective and life-changing for those individuals.
And someone asked, when do you or should you stop Botox?
When do you stop is a personal choice. There's, Mother Nature is not going to stop working against us. So, we keep using Botox. It's a personal choice. If you like having some of the lines, then you wouldn't do Botox. If you want to soften some of the lines, or if you feel like your brows are getting heavier, people do it just to get a little bit of a lift out here. You put a little bit in the center to get a little bit of a lateral lift. So there's no one answer to that. There's no danger, if that's the question. I mean, you're not going to hurt yourself if you keep doing Botox your entire life. It's just a personal choice. And,
of course, the neck. You can't do Botox on the neck. You can do the Ulthera on the neck, which we just talked about, which tightens the skin, correct?
Yeah, but you can do Botox right here on the neck, in the central part of the neck. And as I mentioned, for people who don't want to undergo doing Ulthera, it's a very, I'm sorry?
That tricky neck that comes down over time?
Yeah, so there's two things that happen here. One is the skin laxity, and underneath the skin is a very thin muscle. It's a muscle that goes from the jaw all the way down to the collarbone. It has a funny name. It's called the platysma muscle. And it's a very broad, wide muscle. By injecting the central part of the platysma, it makes that muscle not so strong, but the outer part of the muscle lifts up. So that's how you get a lifting. Other people will get a little pouch of unwanted fat cells in here. And there are some treatments. There's something called Kybella, which has come out a few years ago, which has mixed results depending on the individual. And Kybella is an injectable product that can be injected into the fat pouch that some people develop, and it can shrink away and melt away some of that fat. Again, results are variable depending on the individual, but Botox has a much broader efficacy, for sure.
A lot of people asking about my glasses again. I have this is the smaller size version. I have the larger ones too. They're made by Caddis. Will you text through the information on the website? I think you know it. So just to review, Dr. Lance Brown, thank you, skincare and cancer specialist. We so appreciate your time today. We didn't get to talk about atopic dermatitis. We didn't get to talk about eczema. But if you want to reach out to Dr. Brown, how can the viewers reach out to you, Doctor?
Okay, great. So my website, I have a website. It's drlancebrown.com, DRLANCEBROWN.com. I have an office in New York City at 10 West 15th Street on 15th Street and 5th Avenue. I also have an office in Wainscott at 386 Montauk Highway. And all of this information is on the website. If you go to my website, again, Dr. Lance Brown, www.drlancebrown.com, all of this is there with patient information, procedures that I perform, conditions that we treat, and I'm spending my time mixed between the city as well as out here. There are a lot of people who've been out here, patients of mine and others who have moved out since the beginning of the pandemic and don't want to go back to the city. And so it's been a real pleasure to be able to serve my patients and even new people that I'm meeting out here for both medical as well as cosmetic, but, skin cancers as well at the office out in Wainscott. And I'm available for appointments, and I'd be happy to help in any way, anyone who has questions.
Thank you so much. So just to review, this will be up on my Instagram, so people can go back to see or to listen to Dr. Brown talk about mask knee, which was sort of the top of the talk. We talked about melanoma, non-melanoma, and Mohs surgery for skin cancer. We talked about hydration and what the big myth is of that. Hydration for the face, body, hands, and neck. We talked about skin generation, the importance of retinoids as an effective exfoliant for the skin. Dr. Brown recommends Cetaphil as a cleanser, Differin as a good retinoid, and clindamycin as a good topical antibiotic if needed. But keep things simple. He believes in 3 types of topicals: cleansers, moisturizers, sunscreen, which you repeat throughout the day, every hour, in fact, is what he mentioned. So that'll get you through the summer. Dr. Brown, thank you so much for your time today. Appreciate it so much. If anybody has any questions, you can ask Dr. Brown and go to him through the website. So thank you.
Cristina, it's been a real pleasure. I thank you. It was a lot of fun answering and fielding these questions. I thank you for your time and for the opportunity. And again, it was a really fun time. Thank you.
Thank Andrea for typing up all of your answers so that people can on text and write down the problems suggested. So thank you, Andrea.
Yeah, the staff at Purist has been fantastic and wonderful, and really, nothing but a pleasure to work with. So the whole experience has been great, and I appreciate your time.
And thank you, everybody, for your compliment. It always help. And I wish everybody a wonderful Thursday. Take care.
Thank you. Bye-bye now.
Bye.